A case study may be exploratory, explanatory, descriptive. Rational use of drugs is essential due to high treatment cost, drug explosion. Recurrent cost includes drug cost, personnel cost. Primary health care is constrained by dash care, unequal care, fragmented care, fabricated care. A case control study is featured by natural exposure, recall, comparison. Outcome of cost-effective analysis is quantitative, tangible, variable. Determinants of occupational disease are ecosystem, climate change, tools. Phase of research process includes inductive phase, deductive phase. Biological effects of light are degradation of bilirubin, stimulation of melanin synthesis, synthesis of vitamin D in the skin. Measures use same denominator are IMR, MMR, NMR. Carcinogenic air pollutants are PAH. Particulate matter is also known as aerosols, is an indicator of air pollution, may be carcinogenic, is respirable dust. 2.5 mu has severe health effect. Silicosis is caused by free silica, silicon oxide. Primary air pollutants include carbon monoxide, VOC5, Occupational safety and health relates with NIOSH, OSHA, ILO. Occupational safety and health relates with NIOSH, OSHA, ILO. Energy expenditure process in body includes basal metabolic rate, physical activity, thermal effect of food. Bioavailability of drug depends on rate of absorption of a drug. Rate of absorption of a drug, fast pass metabolism of drug, route of administration of a drug. The stages of adoption are evaluation, trial, adoption. The stages of adoption are evaluation, trial, adoption. SDG is backed up by 169 targets. Steps of RCT include drawing protocol, sampling, manipulation. Indications of cohort study are good evidence of association, stable cohort. Key messages of Global Health 2035 are fiscal policies, convergent initiatives, impressive returns. Sector-wide approaches in Bangladesh are HP, NSDP, HN, PSP, HP, NSP. Community participation is constrained by differing priorities, stakeholder discharge. Community participation is constrained by differing priorities, stakeholder discharge, community motivation. Community motivation. Levels of database architecture are conceptual level, internal level, external level. An accident is influenced by vector agent. Policy research includes case studies, surveys. Outcome of experimental study is measured by relative risk. In built association is done in descriptive cross-sectional study. A population pyramid could determine population momentum, baby boom, migration, life expectancy, dependency ratio. Cumulative trauma disorders include carpal tunnel syndrome, epicondylitis. Clinical geriatric deals with biological study of elderly, promoting geriatric health, psychological study of elderly. Campaign on rural hygiene took place in Bandung, Alliance of League of Nations. Major moments of public health were in disease control phase, health promotional phase, 1920 to 1960, social engineering phase. A latent variable includes efficiency skill. Parametric tests include T-test, Z-test. Disaster risk is proportionate to hazard vulnerability. Agenda of health challenge includes emerging agenda, quality agenda. Paradigm of health system research includes critical theory, positivism. Population policy is comprised of rational program measures, targets. Models of evaluation research are scientific experimental model, management oriented model, patient oriented model. Health promotion actions in Ottawa Charter include create environment for health, reorient health services, develop personnel skill. Modern concepts of disease causation are epidemiological triad, multifactorial causation. Biological effects of complements are opsonization, chemotaxis, cytolysis. In secondary immune response, the lay period is typically 3 to 5 days. Immunoglobulin G antibody level persists longer than primary response. No memory cells are developed. Pillars of hospital infection control are hand washing, isolation of patients, prudent use of antibiotics. 5S Kaizen TQM is suitable for participatory approach, developing ownership. Essential newborn care includes thermal care, cord care, breastfeeding. To reduce global NCD burden by 2025, WHO focuses on salt or sodium intake, raised blood pressure, tobacco use. Case control study can estimate attributable risk, cost product ratio, exposure rate. The sections of a journal article includes introduction, methods, abstract. Bias in research can be minimized by proper sample size, pre-testing, matching, binding. Qualitative study includes case study, ecological study, interpretive study, phenomenological study, case series study. Major manifestation of rheumatic fever includes cholera, subcutaneous nodule. Important pre-inflammatory cytokines are IL-1, IL-6, TNF. Initiation of breastfeeding is influenced by health of a mother, perception of mother, fluid intake by a mother. Mucormycosis is caused by saprophytic molds, is also known as black fungus, is caused in patients with reduced host defense. High potency vitamin A can be given to children of 1 year, children of 4 years. 1 serving fruit means 100 gram orange contains 2 gram protein. Long-term effects of lower birth weight are chronic dyslipidemia, blindness, intellectual disabilities. A hospital budget may be stationary budget, category budget, event budget, envelope budget, marginal budget. Healthcare consumption cost includes personnel cost, opportunity cost, loss of income, unofficial payment, family cost. Criteria of a research includes avoidance of duplication, clear statement of the problem, feasibility, specific plan, applicability. Cluster sampling is featured by selection of clusters by geographical criteria, inclusion of all the members of a cluster, randomization among the clusters. Ecologically sound waste management includes waste reduction, segregation, composting. Ionizing radiation includes neutrons, beta particles. Soil is the reservoir of mycetoma, amoebiasis, anthrax, tetanus. Learning is ongoing, continuous, regular. Group discussion requires more alternatives, more time. Harvard referencing is featured by author-date system. References are listed in alphabetical order. Vitamin C helps in maturation of collagen tissue, ion absorption, lipid peroxidation. Zinc helps in reproduction, helps in healing process, helps in growth. Components of good governance includes reducing risks, following international standards, driving quality improvement, ensuring safety. Cellular components of innate immunity are dendrite cells, eosinophils, macrophages, natural killer cells. Principles of research ethics are respect, benefit, justice. Organochlorine compound includes aldrin, linden. Causes of neonatal mortality are sepsis, birth injury. Purposes of ICD-10 are to develop uniform classification of disease, make accurate comparison, facilitate health problems, maximize profit, ensure easy management of healthcare. Pneumoconiosis is a chronic lung disease, occupational fibrotic lung disease, irreversible occupational lung disease, cause of eggshell